Thank you for joining this episode of UAB Medicine's Post-COVID Lunch and Learn series. Today, Dr. Kristine Lokken, Associate Professor and Chief Psychologist in the Department of Psychiatry and Behavioral Neurobiology, will be discussing brain fog, insomnia, and stress coping after COVID. Please submit your questions in the Q&A, and if time allows, at the end of today's presentation, Dr. Lokken will try and answer as many questions as possible. For those of you new to Zoom, you will find the Q&A button at the bottom of your Zoom window. I will pass this over to Dr. Lokken. Dr. Lokken?
Thank you, Laura, and thank you all for joining today's webinar. It is my pleasure to talk with you today about the common complaints of brain fog, insomnia, and stress following a COVID-19 diagnosis, and then also about some strategies for ways that you can cope. So this talk is the 7th in the post-COVID webinar series. And if this is the first talk that you have attended, I really encourage you to go to the UAB post-COVID website where the other talks are recorded. I've watched them all, they're fantastic and just chock full of useful information. So for today's talk, I'm going to provide an overview of the neuropsychiatric effects of post-COVID. And I'm going to start out with some important definitions, and then I'll focus on more of the general effects of the pandemic itself on mental health. And then we'll take a deeper dive into the neuropsychiatric effects of acute COVID syndrome, and then more of the severe disease course of COVID. And then we'll talk a little bit more about post-COVID symptoms and neuropsychiatric effects. And then finally, we'll review some strategies that can help. So to begin, what is neuropsychiatric? So neuropsychiatry or neuropsychology is the combination of neurology and the disciplines of psychiatry or psychology. So those trained in neuropsychiatry or neuropsychology, such as myself, have a lot of training in terms of concern with the disorders of behavior of the central nervous system, including the brain, so neurology, and also the effects on the mind or emotions, such as psychiatry or psychology. And so many syndromes, including post-COVID, have neurological and psychiatric symptoms that are so inextricably linked that it's nearly impossible to tease them apart. So for example, as we will discuss, being infected with COVID-19 can cause some biological changes that can result in cognitive or thinking issues. And then if someone is experiencing cognitive or thinking issues, they might have some anxiety or depression over that or how they adjust to that. And these symptoms of depression or anxiety can further increase the cognitive issues. So these symptoms are best characterized together as neuropsychiatric or neuropsychological syndromes. The next definition is of what is meant by post-COVID. And the CDC and NIH continue to explore the best definition for post-COVID, but generally it's that umbrella term for the wide range of health consequences that are present more than 4 weeks after infection with SARS-CoV-2. And so at UAB and many other medical centers, we are defining post-COVID-19 as symptoms that develop during or after COVID-19, so a new onset of symptoms. And these symptoms typically continue beyond 12 weeks after the illness starts. And most importantly, the symptoms are not better explained by another diagnosis. And so as you will see, symptoms of brain fog, insomnia, and anxiety can be complicated with many different underlying causes. And so now we're gonna, now that we've reviewed the definitions, I'm gonna speak on the general effects of just the pandemic alone on mental health, irrespective of actual COVID-19 infection. It's important to understand the literature on mental health and the pandemic as a milieu for discussing post-COVID syndrome, as psychological and cognitive issues associated with the pandemic very much complicate the clinical picture. So it was apparent early on in the pandemic that independent of actual infection of the virus, that the pandemic leads to increases in mental health issues, and this could be secondary to job loss or isolation with the pandemic, anxiety over getting the virus, and then also the ensuing social unrest that developed in our nation. There was also an increase in difficulties with focus and attention and concentration just due to disruptions in routine and for parents and students trying to learn from home or work from home. In addition, memory issues and dementia and delirium also increased in the elderly, secondary to isolation and the lack of mental stimulation. So to rapidly monitor general public changes in mental health, the National Center for Health Statistics partnered with the Census Bureau on an experimental data system called the Household Pulse Survey. And during the pandemic, about 4 in 10 adults in the US reported symptoms of anxiety or depressive disorder, and that was up from about 1 in 10 adults in the previous year from January to June of 2019. Also, elevated levels of adverse mental health conditions like substance abuse and suicidal ideation were reported by adults in June of 2020 in representative panel surveys across the United States. And certain groups were disproportionately affected and reported worse mental health outcomes, with at least one adverse mental or behavioral health symptom reported by 75% of younger adults aged 18 to 24, which is a frightening number, and 52% of those aged 25 to 44, 52% for those of Hispanic ethnicity, 54% of essential workers, and also 67% of unpaid caregivers for adults. Vindegard and Benrose conducted a systematic review of the pandemic and mental health that was published in October of 2020. And those findings indicated that for those who were not infected by COVID-19, there was pre-existing worsening of those, those with pre-existing psychiatric disorders reported worsening of symptoms. There were also higher levels of psychiatric symptoms among healthcare workers, and there was an overall decrease in psychological well-being in the general public. The study also found, another study also found that all health events that occurred after April 1st of 2020 had higher rates of mental health issues associated with it, and that mental health issues could also affect someone's susceptibility to getting COVID-19. In addition, there was increased first diagnosis of anxiety and PTSD and insomnia, and higher rates of dementia among those individuals that were 65 or older in days 14 to 90, and those who actually had a positive COVID-19 diagnosis. Also, ICU admissions resulted in higher risk of psychiatric complications. However, more psychiatric issues remained even in those individuals with mild COVID-19 courses, with most reported incidents of anxiety disorders, insomnia, PTSD or post-traumatic stress syndrome, and then also dementia. And this leads us into the neuropsychiatric effects of COVID-19. In the next 3 slides, I'm going to focus on the neuropsychiatric effects of COVID-19, first in the acute or early course of COVID-19, and then in those with a severe disease course of COVID-19, and then finally in those with persistent symptoms post-COVID-19 infection. So researchers are still unsure of the mechanisms by which COVID-19 causes neurological and psychological symptoms. There's just still so much more that needs to be understood, but there does seem to be general agreement that infection with COVID-19 virus is more likely to affect the brain. And there are several direct or indirect effects of COVID-19 on neuropsychiatric outcomes that have been posited, including vascular issues or endothelial or inflammatory mechanisms, as well as hypoxia or sedation or the complications of post-traumatic stress disorder or other mental health issues. So some of the proposed mechanisms that are currently under research and are being explored are hypoxia-mediated injuries. So that means that the cognitive issues might be caused by a lack of oxygen to the brain due to the respiratory nature of the disease, or a systemic pro-inflammatory state, or blood-brain barrier disruption caused through ACE2 receptors, or what's called a cytokine storm. And cytokines are cell signaling molecules that assist in immune response. And so a cytokine storm or cytokine release syndrome can happen when an infection triggers the immune system to flood the bloodstream with inflammatory proteins called cytokines. And so this is really an over response of the immune system that can lead to tissue and organ damage. And so in some cases for the acute presentation of COVID-19, there can be a delirium that is pretty rare, and usually it's typically associated with a severe course or with those elderly who have already had more of a dementia process. Anxiety is really common though, because people are very scared about their health or even worried about potentially dying. Depression is common in that acute illness stage. And then insomnia just seems to be a part of the COVID-19 initial presentation and ongoing presentation. So many of the patients that I have spoken to describe that they were suffering from this excruciating fatigue and exhaustion, but they couldn't sleep no matter what. And so those are kind of some of the initial neuropsychiatric conditions that people experience when they first get COVID-19. Many of these resolve over time or resolve as the illness, goes away. However, some of them do remain, and we'll talk about that more in terms of the post-COVID presentation. In terms of severe COVID-19 course, there does seem to be a pretty clear evidence that those who suffer a severe course of COVID-19 have cognitive alterations during their acute course, and that they are more at risk for neurocognitive manifestations of the post-COVID syndrome and possibly even dementia. So I think we're all familiar that risk of severe COVID-19 course increases with age and underlying medical conditions. And these conditions can be pretty rare, but have been reported among those with severe course of COVID-19, including confusion or a delirium, which is an acutely disturbed state of mind that can occur with high fever or other issues, impaired consciousness, encephalitis or encephalomyelitis, which is inflammation of the brain or the brain and spinal cord. Seizures have been reported in some cases, and stroke. And so, of course, if someone is experiencing those type of neurological effects, more than likely they're going to have some type of cognitive issue or psychological issue after ICU discharge. And so studies have found that patients post-ICU discharge, especially those who have suffered from a delirium, perform more poorly on cognitive performance and thinking tasks. And so there's a group of neuropsychologists out of Weill Cornell that published findings in the fall of 2020. And they found that there was more of a dysexecutive syndrome. So inattention, some disorientation, and difficulties organizing a response to command in those patients that were post-ICU discharge. It is thought that patients who have had a severe course of COVID-19 may be at higher risk of dementia, but this is really unknown at this time. In my clinical work for the patients that I've seen, there does seem to be a pattern of those who have had some early dementia or mild cognitive issues prior to getting COVID. After COVID, they are kind of pushed right into more of a dementia syndrome afterwards. But that's just anecdotal at this time, and we're still needing to study a little bit more about the course and the neural trajectory of those having severe COVID-19. So this leads us to a discussion of the persistent neuropsychiatric effects of COVID-19. There have been several terms used to describe this phenomenon. Post-COVID is kind of the most common one. It's also referred to as long COVID, and a lot of patient groups have identified themselves as long haulers. Chronic COVID is also a term that's been used. And then PASC, or post-acute sequela of SARS-CoV-2 infection, is the more clinical term that's being used to describe the persistent symptoms following COVID-19 infection. And so PASC consists of this constellation of symptoms, and it seems that each patient is kind of unique in their presentation. One study identified as many as 109 different reported physical, emotional, and cognitive symptoms associated with PASC. And here is a list of some of the most common neuropsychiatric symptoms that are reported by patients. So a lot of patients report headaches with new onset or more severe course of headaches. Sleep disturbances are just almost a part of everyone's post-COVID experience. And some have described it as COVID-somnia. The loss or alteration of smell and taste. Some neurocognitive deficits or brain fog, which we'll talk about in just a minute. Fatigue, excruciating fatigue. Also postural orthostatic tachycardia syndrome, or POTS, or dysautonomia. Paresthesias, which are small fiber neuropathy. And of course, the anxiety, mood changes, and trauma response. As a part of the post-COVID treatment clinic at UAB, I've interviewed about 100 patients that have been referred to me. And it's been really interesting to me that nearly every single one has trauma as a part of their story. That could be past trauma that's re-triggered by them going through the experience of having COVID-19, or it can be that they had trauma during their course where they were really scared that they were going to die or witnessed a loved one dying from COVID. And also there's been trauma related to misunderstanding of their symptoms by medical professionals or their place of employment, and also ostracism during or following the acute disease process. Also, functional neurological disorders are often seen with patients who have post-COVID syndrome. And functional neurological disorder is really when there's a problem with how the brain sends and receives signals rather than a structural disease process. So as you can see, it can be really difficult to distinguish symptoms caused by post-COVID conditions from symptoms that could occur for other reasons, such as just being a part of a pandemic itself. However, if you are suffering from persistent neuropsychiatric effects of COVID-19 infection, you're not alone. Estimates vary widely throughout the literature. However, in a publication in The Lancet, there among those over 200,000 with COVID-19 survivors, there was an estimated incidence of about 33.62% of neuropsychiatric diagnosis. And of those, about 12.84% were reporting this as their first diagnosis following COVID-19. It seems like the big three are depression, anxiety, and trauma. And it seems to start this vicious cycle and kind of a circularity of symptoms where patients are having this crushing fatigue, and the fatigue leads to poor sleep habits because they're so tired. So they might be sleeping too much throughout the day, which leads to sleeping at the wrong times, and then leads to more insomnia type symptoms. And this leads to depression and then to anxiety. And with depression and anxiety can lead to cognitive disturbance, and the whole cycle just kind of continues. And the cognitive issues and the psychiatric symptoms are exacerbated and perpetuated. And we know from previous literature that stress, trauma, depression, anxiety, insomnia, and functional neurological disorder can all increase and exacerbate cognitive symptoms. And so those things can really make the picture worse. And as I said, it's kind of a part of the picture. So if you're experiencing any of these things, first treating some of the stress, trauma, and depression and treating insomnia is going to be really in treating the cognitive issues as well. So what is this brain fog that everyone is talking about? Approximately 1 million Americans are suffering from persistent brain fog after COVID-19. So it is not a rare thing. And this is estimated from about the 30 million individuals that were infected with COVID-19, about the 35% that have the persistent neurocognitive or neuropsychiatric effects of long COVID, and then the 10% with cognitive symptoms. And this is really not something new. Brain fog is often reported with other post-viral infections. So in Lyme disease or Epstein-Barr or West Nile or even Ebola, patients complain of this brain fog after this virus after they've run the acute course of the virus, and the persistent brain fog is still there. And so there's not a great definition of brain fog, but when I say it to patients, they know exactly what I mean. And it seems like it's this perception that the mind is clouded by a haze, and it can result in slowed thinking, difficulty making decisions, difficulty multitasking. A lot of my patients, that was their superpower before, where they could multitask, and now they're just really struggling with doing more than one thing at a time. Also trouble sustaining concentration, and there are reported memory problems, but I'll get to that in just a minute. And so again, brain fog is really nothing new, both in terms of post-viral infections, but also in other neuropsychological syndromes that involve diffuse neuronal injuries, such as traumatic brain injury, multiple sclerosis, or what's been called chemo brain in cancer survivors, or in a lot of parallels with chronic fatigue syndrome and ME, or myalgic encephalomyelitis. So to date, there have been just very few studies examining the neuropsychological pattern following a milder course of post-COVID. There was one study by Graham published in March of 2021, and they examined cognitive dysfunction in non-hospitalized COVID-19 long haulers. And the main neurological manifestations that they found were brain fog in 81% of those patients, headache in 68%, numbness and tingling in 60%, and also fatigue in about 85% of those patients. The number of patients that actually underwent cognitive testing in that study was very small. It was only 19 patients, and it was a really brief battery, but they did find that those patients were having difficulties with attention and working memory, and also mostly with attention and working memory. And working memory is really that ability to keep information in your head for use, like trying to remember a phone number. So since the inception of our UAB post-COVID treatment program, I've been focusing a good deal on post-COVID in both my clinical and research work. And clinically, I'm part of the UAB post-COVID treatment group, and I've done approximately 60 full neuropsychological assessments on patients, and then an additional 40 plus interviews on patients who have more just psychiatric symptoms of anxiety or depression or trauma. And themes have really been popping up throughout patient stories, and the symptoms are very, very similar. We are currently putting together a data set to examine these neuropsychological profiles and through research mechanisms, and so we don't have that full data yet, but preliminary examination and through kind of looking at it through a clinical lens, almost all of the patients are reporting severe fatigue, insomnia, depression, anxiety, trauma, and physical or somatic complaints. I'm also seeing just marked severe processing speed deficits, inefficient mental flexibility, and interestingly enough, although almost every single patient complains of learning and memory problems, when we test them, they're actually fine or doing pretty well in memory. And so it's probably more of a problem that there's just a slowness in terms of getting that information in, and the slowness in terms of accessing that information when you need it, and also that difficulty in terms of mental flexibility and that's really leading to more perceived memory issues, although we're really not seeing it in terms of our clinical data. So in terms of future directions, just more research is needed. This is so new, and we are getting more research by the day. But we need to find ways to identify, like early identification for treatment of individuals who are most susceptible to the psychological and cognitive issues following COVID-19. And I think there has been some work in terms of identifying some biomarkers of those individuals. We also need to test interventions like cognitive training or non-invasive methods or lifestyle modifications to promote successful outcomes and successful cognitive aging in those post-COVID survivors. So now we get to some of the strategies that can help. So although this has been so difficult for patients because when you don't feel well, it's really hard to keep your rituals and your routines on track. Also, we're finding that many patients are kind of forgetting to hydrate. They're forgetting to drink water, or they might need water with some electrolytes in it, to just kind of keep hydrated. We're also encouraging patients to really follow more of an anti-inflammatory diet because it does seem like neuroinflammation is part of the brain fog issues, and it can also lead to depression and anxiety. So trying to eat a diet of just whole foods, real foods, those that are low in inflammatory mechanisms will be really helpful. We also are encouraging patients to exercise, and it kind of feels counterintuitive when you're fatigued to exercise, but that is actually one way that you can combat the fatigue. Resting kind of begets more fatigue. And so what we don't want anyone to do is to push themselves, but to start off really slow and low and do as much as you can. And that might just be a 5-minute walk, but it's better than not doing any exercise at all. We're also finding that cognitive stimulation has been really helpful for patients. There are many different ways to do this. Some are just, engaging with family members and friends in, socially safe ways. Also, there are some, brain training programs. Some are reputable and some are not. One reputable program is Brain HQ. And that's an online program that really helps with processing speed. We also are recommending that patients do take time out for rest and relaxation. Sometimes when you return to work and you're struggling, you work more, and that has been really hard for patients. So to try to talk with your employer or set up your days where you do promote some rest and relaxation. Stress management techniques are important, making sure that you include time for joy, purpose, and meaning, and also making sure that you protect yourself and give yourself that time to heal. Nobody is going to just go right back from having a course of COVID-19 right back to where they were. And so giving yourself that time and that grace to heal. Also, sleep and memory are really, again, linked together. Their sleep issues cause the 3 big M's, the memory issues, mood issues, and can also lead to metabolism issues. So we want to make sure that you're able to get your sleep back on track. Many of the patients that I'm seeing are really not following the sleep duration recommendations, which would be, about 7 to 9 hours for young adults and middle-aged adults, and then a little bit lower than that for older adults. And so making sure that you're getting consolidated sleep during that time. Tips for better sleep include sleep hygiene, like no coffee after 2 p.m. And it's hard for people that are feeling really fatigued at work to stay away from the coffee, but it just perpetuates the cycle. Also creating a relaxing ritual before bedtime, turning off the TV and blue blocking light on digital devices, because that's been known to disrupt melatonin levels. Taking a warm bath or a hot bath before bedtime with Epsom salts, which will increased magnesium levels, and some lavender essential oils, which can induce more of that sleepiness and tiredness, and then using bedroom for only sleeping and intimacy. So we put together a handout that should be on the UAB post-COVID website, and there are some simple coping strategies and some apps that you can just download on a smartphone for anxiety and stress management. So I'd encourage you to check that out and see if any of those techniques are helpful to you as you manage anxiety or depression. And also the apps are super useful and can set you up with reminders or ideas of how to manage stress. Also, there is something called cognitive behavioral therapy for insomnia, or brief behavioral therapy or treatment for insomnia. So CBTI or BBTI, and it's really a short course of psychotherapy that focuses very specifically on sleep hygiene, which we just went over some of those techniques, and then sleep restriction. And patients really are finding that their sleep improves really rapidly by following a course of CBTI or brief behavioral treatment for insomnia. We also recommend seeking out a psychotherapist or a counselor that can do cognitive behavioral therapy for anxiety or depression or adjustment to illness. And that's a type of therapy where you're really given some coping skills to help with all of these issues. And for those who are really suffering from more trauma-based issues, whether it was, again, retriggering of a trauma issue from prior to COVID or during COVID, there is a specific type of therapy called cognitive processing therapy, which has been really empirically validated and supported to help patients really recover from that trauma experience. And in the Department of Psychiatry, we're working to offer a post-COVID class series moving towards wellness, where we just kind of go a little bit more in depth into some of these coping strategies. Also, I wanted to mention that Dr. Jachendra Uswete and Ed Taub are doing the UAB constraint-induced cognitive therapy research study. I've referred several patients to this, and they are having a lot of relief in terms of some of their brain fog symptoms and some of their just functional symptoms after going through this. So if you're interested in that, that's another resource. There are also some structured cognitive rehab programs that you can seek out with healthcare providers, also engaging in mindfulness practices that can be really helpful in terms of reducing anxiety and also reducing brain fog. And then again, like the lifestyle interventions, that's kind of my passion, is to teach people how to live healthy lifestyles and incorporate health behaviors just to provide that foundation in terms of helping with brain fog and psychological issues. So today's key points, in summary, brain fog, insomnia, mood symptoms, anxiety, and trauma are responses that are common after COVID-19. Many people are reporting these. Implementing these good lifestyle habits, kind of getting those back on track if you've fallen away from some of your exercise routines or your healthy eating routines, and stress management techniques are really the first key to recovery. And if your symptoms persist more than 3 months or definitely more than 6 months, do seek help from qualified mental health professionals or other healthcare providers. And please stay tuned for the following two post-COVID webinar series. Next week, we'll have Dr. Amanda Carty present, and then we'll end this series with Dr. Stuart Cohen presenting on the post-COVID syndrome and your primary care physician.
Thank you, Dr. Lokken. You have covered most of the questions that have been asked in your talk. Thank you so much. And we are almost out of time. Thank you everyone for joining us. We hope this information has been helpful and informative. To register for other post-COVID Lunch and Learns, or to view a recording of today's session, along with the Q&A, visit uabmedicine.org/post-COVID. Thank you all.
Great, thank you.